Good evening and welcome to Canandaigua Academy. My name is Matt Trage. I'm the Assistant Superintendent for Instruction for the Canandaigua City School District. We'd like to thank you and welcome those who have joined us this evening, either in person or virtually, for our Mental Health Night. This event has been shared with districts across Ontario County, and we would like to welcome those of you joining us from other districts. As part of our region's commitment to building awareness of mental health needs and resources, members of the Canandaigua City School District faculty began planning this event over the summer in hopes of not only continuing the discussion around the importance of mental health, but to also provide families with an opportunity to connect with community-based resources. We know that the impacts of the COVID-19 pandemic have only highlighted the role that mental health plays in the lives of our students, families, faculty, and staff. We hope that tonight's panel discussion is a way for us to continue the conversation around mental health, but also connect all of you with information that you will find useful. First, a little bit about tonight's format before we meet our panelists. We will ask our panelists a series of questions. The first question is overarching for all panelists to respond to, while the remaining questions are specific to certain panelists. Panelists will add details to other panelists' questions as they see fit. We anticipate that the total time for the panel discussion will not exceed 40 to 45 minutes. At the conclusion of the panel discussion, microphones are located at the start of the aisles for attendees to approach and ask a question of the panelists. If the panel discussion ends sooner than the 40 to 45 minute time frame, we will move to the Q&A portion sooner. At the conclusion of the Q&A portion, we invite attendees to stop by the atrium located outside of our auditorium, where we will have tables set up by representatives of Ontario County-based organizations. We would like to thank these organizations that have brought information and resources for our attendees to access. Some logistical pieces. In the event of emergency, please locate the nearest exit, and in the event of an emergency, please exit in an orderly fashion. We ask that all in-person attendees remain masked during all activities. We are permitting our panelists to remove their mask while responding to a question if they are comfortable doing so. This is to provide clarity of the audio of their responses, both for the discussion and the recording and live stream of tonight's event. Our panelists are socially distanced and have individual microphones. We were anticipating that Adam Chodak from WROC TV Channel 8 would help moderate this evening's discussion. However, due to an unanticipated conflict, Adam will not be able to join us this evening. We do appreciate Adam's consideration of participating in tonight's event and hope to have him back in the future. In his place, I will serve as the moderator. Now, let's meet and welcome our panelists. First, Mr. Peter Dole. Peter is currently a licensed clinical social worker working for Wayne Finger Lakes BOCES as a behavioral specialist in one of their 612 social skill development programs. Peter has over 20 years of experience working with young people struggling with mental health related needs. In addition, he has served as a certified adult and youth mental health first aid trainer for the past 5 years. As a result, Peter has worked with hundreds of caregivers, school personnel, community service providers, higher education staff, law enforcement, and others to build awareness about the importance of talking about learning about the mental health challenges that are faced by young people today. To Peter's left is Dr. Katie McFarland. Katie is a parent to 2 Canandaigua Academy students, former special education teacher, and current director of the Canandaigua Academic and Career Center. Prior to moving to Canandaigua in 2013, she and her family lived in her hometown of Cuba, New York, with lots of great cheese, a small rural Allegheny County community in the southern tier. To Katie's left, Dr. Jessica Mitchell. Dr. Mitchell received her PhD in clinical psychology in 2010 from the University of Southern Mississippi, with a specialty in child clinical psychology. She completed her predoctoral internship and postdoctoral fellowship training at the University of Rochester Medical Center. Her research focus explored the impact of self-perception on youth behavior, particularly conduct problems or delinquency. Dr. Mitchell has been the Director of Community Services for the Ontario County Mental Health Department since September 2020. In this role, Dr. Mitchell is responsible for identifying, planning, and developing programs to meet residents' service needs for mental health, alcohol and substance use, and developmental disability services. Previously, Dr. Mitchell worked for many years in the county's mental health clinic as a supervising psychologist In this role, Dr. Mitchell provided direct therapy, evaluation, and consultation services to clients of the clinic and the Ontario County Courts, training and supervising clinical staff, administrative duties related to the development of clinical policies and procedures, development and coordination of the county's court-ordered assisted outpatient treatment program, and assist in the development, coordination, and training of the county's crisis intervention team in collaboration with the Ontario County Office of the Sheriff. Finally, we'd like to welcome Cindy Vanderlee. Cindy Vanderlee has been working as a prevention specialist for the Canandaigua City School District for the past 24 years. Prior to that, she supervised the Home and Community-Based Waiver Program at Crestwood Children's Center, worked as a caseworker for the PINS program in Brooklyn Family Court, and for a foster care agency in New York City. As a prevention specialist, her primary job is to connect students and families with services and support in both the school and the community to address at-risk behaviors such as absenteeism, mental health issues, and behavioral difficulties. She believes that all students and families have strengths that provide the foundation on which positive change can be made. She also believes in the resources in our community and school and that we should be utilizing them to help our students and families. Cindy lives in Fairport with her husband and their energetic and inquisitive 10-year-old son. They have a goofy 4-year-old sheepadoodle dog that they adore. They also love to travel and are always up for adventure as a family. Let's please welcome our 4 panelists. So we're going to move right into our first question, which is an overall question for all 4 of our panelists. What signs should families look for in their child that might help them assess if a child is in need of support? What is the best way to get professional help for a child if there is an urgent need?
I guess we can go right down the line.
Sure. Sounds great.
Welcome. Thank you all for having me. I think when I think about this question, I like to keep 2 things in mind. First of all, the idea of functioning and, what that is for that specific young person. And, functioning, is something that's going on with that young person, whether it's a mental health challenge or a possible mental health disorder, is that affecting that child's ability to function. And typically, and most often, we want to look at whether that functioning is being affected in multiple settings as well. So not just school, but at home, maybe in pleasurable activities, those types of things. So I think for me, the idea of looking at a young person's functioning and, is a young person functioning here and then all of a sudden functioning, down here across all settings, or vice versa, is a young person functioning here and then all of a sudden, they're functioning, way up there with, elevated mood or whatever that might be. So, in my mind, I think that the idea of overall functioning is super important.
So I think kind of piggybacking off of what Peter had just said, I think one of the major things that I talk with families about is like looking for changes in the child's behavior. So, as parents, like your child best, and so you kind of know what their baseline is in terms of, are they, getting along with other kids okay? Are they getting along with their siblings okay? Are they sleeping enough? Are they, anything? So what I talk about with families is if you notice a significant change in your child's behavior, such as isolating more in their rooms, or like Peter said, not doing things that they normally like to do, or complaining about doing those things when they are doing them. I think that can be a really important way to kind of know whether something is going on. The other thing is that you can reach out if you suspect things are maybe not quite so okay with the child. You can talk with the child, ask them how they're doing, ask them if they're okay, and then also check in with the other adults in their life, such as teachers at school, things like that, because they also have a baseline for how your child is operating in that setting. And so having those different pieces of information can be really helpful.
I'll
Okay.
So, so coming from a parent's perspective, and I want to say, give yourself some grace too, because sometimes, in situations that I've seen in working with children, not just my own, is they don't want you to feel burdened. They don't want to bother you. I often hear, I'm sorry, I don't want to interrupt. And so in lieu of kind of talking about it, it may at first be yes. And we've seen signs of stomach ache, and we feel reason or rationale behind the stomach ache or headache or avoidance of tasks. Avoidance of school is a big one, I think, that we see and we've seen in our own personal experiences. But also give yourself some grace and know that in terms of a parent, and I know you can speak only to Canandaigua, but the support that we had from the school district, from counselors, teachers, and academic teachers, that we're seeing some things that maybe we weren't necessarily seeing in the strength and helpful. Toss it over to Cindy. That's really a lot of the support that we initially got didn't necessarily come from signs that we were seeing, but from outside.
Yeah, so similar to what the other panelists said, you're going to look for things that, as parents, you're going to look for things that are out of the ordinary for your child. So if your child is normally outgoing and engaging, and all of a sudden they seem sullen or isolating and kind of dropping out of things and not involved in things anymore, you want to be concerned. The opposite is true. If you have a child that's more internalized, more quiet, and then all of a sudden they have outbursts of energy and kind of a lot of highs and then a lot of lows, those are things that you want to keep an eye out for. So oftentimes in a school district, and similar to home situations, we find that students will oftentimes confide in their friends what is happening and if something is awry. So if you are, if your child's friend comes to you with concerns, just make sure that you keep your eyes and your ears open. And similar to what Dr. Mitchell said, we really rely on parents to let us know if something is amiss. You know your child better than anyone. So if something doesn't feel right, please reach out. I never really trusted the parent intuition until I became a parent. And so I just tell you to trust your gut and reach out if something doesn't seem right. The second part of that question, do you want me to address that?
Sure. Absolutely.
So that when I think of the word urgent, I'm not really quite sure how to answer it, but I think of immediacy when I hear the word urgent. And so if you feel that your child is at imminent risk, and imminent means that if you feel your child's life is in danger, somebody else's life is in danger, they really need to be seen at CPEP, which stands for Comprehensive Psychiatric Emergency Program at Clifton Springs Hospital, and you'll need to get your child to CPEP for an evaluation. If your child is at imminent risk and it happens during school hours, we have a mental health team that will be able to assess the level of risk and then make recommendations to you on how to proceed.
So we're actually fortunate that in Ontario County we have quite a few different services, as you'll see after the panel discussion. And there are, in terms of child services, however, that's a little different. So with child services, we have, so obviously at Ontario County Mental Health, children can be seen there. We see children from ages 5 all the way up to adulthood. So we have the community clinic would be an option for any Ontario County resident. We take all insurances, and or no insurance will help folks get connected that way. So you can get connected to services through our office. There are other programs in the community that we also operate out of the mental health department, such as single point of access, which is the way I kind of vision it is sort of like a primary point person who is keeping track of all of available services in the community for certain populations. There's a SPOA for children, there's a SPOA for adults, and they have services connected to them such as case management, housing programs for children, as well as adults. There's a whole bunch of different services that would come out of there. which would include us. We have a person that sits in on that team as well. So, and then there are other programs in the community for younger children. So preschool would be through like Happiness House, which is located in Geneva. So there are also a number of private agencies in the area that see children, and their group practices, such as family counseling of the Finger Lakes is one. So there are a number of resources in the community that you could link to, and I would think that reaching out to the school counselors, your primary care physician, they can also help with connecting you to resources such as these, and then you certainly could contact the mental health department to find out about resources.
So I think that last response is maybe a nice segue into the first question for Cindy, maybe to expand upon a little bit more, which is, who would be the liaison at school to get families in touch with outside agencies, many of which all of you have referenced? And is there any way around sort of the typical months-long waiting list that sometimes families might encounter when it comes to seeing a mental health professional?
So your liaison would be your child's your child's school counselor. They are your first contact. Each building in Canandaigua has a certified and/or licensed social worker, and they are a great resource. And they are also have a myriad of other support services available. So that would be your contact. In regards to the months-long waiting list, I want to let you know that we are not alone here in Canandaigua. This is an issue in the surrounding counties as well too. I wish I had my magic wand, but my magic wand broke, so I have to use our resources and our supports here. But want to let you know that we are here to help support and help bridge connections. So a couple ideas that I can think of is, first of all, the school districts, the social workers and counselors do have personal relationships with a lot of the private therapists in town as well as the agencies in town. So we can make a phone call on your behalf, we can get some more information, and we can advocate for your child. A lot of times therapists know of other therapists who have openings. Last year I made a phone call to a therapist, and I found out that while she didn't have an opening, she realized that there was 2 new therapists that moved into offices right down the hallway from where she has an office. So I was able to get some services for families that way. I made a phone call the other day to an agency that has had no openings for the last year, and I made a phone call on for another reason and found out that they hired a new child and adolescent psychologist, and they have openings. So I think personal connections definitely help. Also, if you are on a wait list, what we can do as a school district is the mental health team in the school can make contact with your child maybe once a week just to check in with them. We won't be providing therapeutic services, but what we can do is check in on their welfare, make sure they're well, and kind of hold them until they can get a spot. Also, if your child was seen at CPEP, that's that psychiatric, comprehensive psychiatric emergency program I just talked about through Clifton Springs Hospital, if they were seen there and a referral was made to an agency, CPEP does provide support phone calls for families, so they can also check in once a week with your child to see how they're doing and keep updated on that. So our job is really, in a school district, is to remove those barriers for you that make accessing those services easier for you and your child. So one of the resources that we have at our fingertips is a great resource. A lot of times families can't afford, maybe they don't have insurance, maybe they can't afford the co-pays for a certain therapist. So we're able to access a great resource called the Ontario County the Ontario County Foundation. We're able to access money for families to help offset the cost of co-pays and service providers. So oftentimes we try to think outside of the box when we are working with families. So we have resources at our disposal that
you might not be aware of. And a couple of those that just pop into my mind are, we have a program called the Family Support Center, and that is a program that operates in 6 school districts in Ontario County, and it provides free counseling to families after school hours in a school setting. There are 2 counselors in the room, and they provide something called solution-focused counseling for families. It's short-term. It's anywhere from 4 to 8 sessions with the family, but that could be a resource for families to kind of hold them and get them some kind of therapeutic services before transitioning over to a private therapist. We also have a great resource in this county called Aspire Hope New York. And a lot of times parents are really struggling with their children, their children's behavior. And Aspire Hope New York is a parent advocacy program. But what's really neat about this program is it's run and operated by parents who are actually walking in your shoes. They know what it's like to go through this, and they are a great resource and they're a great support for many of our families here in Ontario County. And as Dr. Mitchell said, I'll also we can refer to case management services, and these are services that come into the home and provide support for families. And case management services, while they are not clinical licensed social workers, they do have a background in counseling, and they can check in with your child as well. They can be alerted if there is an emergency and get that child to where they need to be. So those are some of the services. As I mentioned before, our job we'll never be able to eliminate all of the stress, but what we can do is reduce the stress for you by getting other kinds of services and supports in place until you are connected with that outside service provider.
Thank you, Cindy. I think that response really speaks to what we have available regionally, but also the role that the school plays in trying to help connect families to any number of resources, many of which I don't know that we're all necessarily aware of. So thank you for highlighting those specific examples, and some of those same services might be available right out in our atrium tonight. So feel free to stop by to see some of the information they may have brought with them this evening. So I'm going to turn the next question over to Peter. So Peter, how can parents and professionals differentiate between sort of normal changes that maybe occur during adolescence that may be different from like an actual diagnosable mental illness? And is there ever a misdiagnosis?
So that's a really good question. And I think, absolutely when we think about typical adolescent development, we certainly think of things like irritability. I mean, think about teenagers and what they go through, puberty, and those stages of development, and irritability and rebelliousness, exploring relationships, even isolation, can be typical adolescent development. So, I absolutely feel like, that makes the mental health diagnosis a little difficult at times, and the idea of just, what is typical adolescent development, and, where does it cross that line? And I think, that goes back to the original question of, is a child's functioning impacted? And, in all areas, in multiple areas, and, kind of that parent intuition that, one of the panelists mentioned, I think is so important, because we know our young people. And to be able to understand that, and to be able to identify those signs, I think is super, super important. And I think the other piece is, when we talk about diagnosable, a diagnosable mental health disorder it's a big deal. It's a life-changing event in many cases. And so often in our in today's society, we throw those terms out kind of loosely, like I feel depressed, and really, the actual diagnosis of depression is pretty significant. We're looking at, you would be looking at going to a doctor or a psychiatrist. a psychologist for that diagnosis. So I think that is really impactful and something that we shouldn't take lightly. I think the other piece is, and I talk about this when I teach mental health first aid, but the idea of that mental health continuum and mental health versus mental illness or a diagnosable mental health disorder. And it's certainly possible for a young person or an individual to have a diagnosable mental health condition, but have really good mental health. And vice versa. It's also possible for somebody to have poor mental health and not to have a diagnosable mental health condition. So I think those are really aspects, and when we talk about mental health, we're talking about those self-care aspects of what we all do and how we take care of ourselves. What are our habits? What are our hobbies? What are our pleasures? What are our passions? And how those affect our overall mental health. And I think that really plays a big role in young people and in that diagnosable mental health conditions versus that typical adolescent behavior. And in terms of a misdiagnosis, absolutely, I think that's possible. I'm sure it happens. I think mental health can be subjective. It's oftentimes it's what's reported. It's not oftentimes what we see, although sometimes we certainly see that, but it's also what's reported as well, and sometimes that can be subjective. So, making sure that, you're taking care of a young person with, talking to their teachers and their trusted adults and their, counselors at school or their therapists outside of school, and really involving, a multiple, a team approach from whoever is on that young person's side, I think is super important and plays a role in an accurate diagnosis.
Thank you. Next question's for Dr. McFarland. So how can parents offer mental health support to their teens who are ready to transition from high school to whatever happens after high school? So any kind of post-secondary experience, what might be some things a parent might offer to their children?
Sure, I'll piggyback on really what Peter said in terms of that open line of communication, the open line of communication with your child, but also as much open line of communication as you can have with the school. And I would backtrack even more, the more early on that you have these communications with either your student counselor or the social worker in the building, and the more, if you have if they have an outside provider for counseling services, the more access that you give as a parent to the school district for the school counselor and their personal counselor or private counselor, the much more supportive I think a student and a child will feel. There are lots of other kind of things that you could do, but I think the most crucial is destigmatizing, and I think we've started a process that is really quite done well in terms of not stigmatizing any mental health challenges that our students have, and really embracing and understanding, and even as a parent, kind of taking some time that what seems like it might not be a big deal to me can be a big deal to my own children, and trying to kind of take a step back and see their perspective. And then, again, just keeping those open lines of communication, because my child could shut down, your child probably could shut down very easily if you very quickly dismiss their anxieties or their fears. One of the things that I'd like to think about, and some of the things that we do in the work that I do, even with our students, is preparing them for whatever challenges they have in the outside world. That although they might have some mental health challenges in school, they can certainly overcome them and be very productive members of society. So we really try to build those skills. And I'll just kind of speak to all of the resources that Cindy spoke of again, that those resources don't just stop outside of school. They continue on out once a student graduates, but if you can get that support and you know that they're out there now, it's so much more helpful when your student or your child is looking for post-secondary anything, whether it be colleges or universities. If they have a really strong mental health facility, which I believe a lot more colleges and universities are having that, but thinking about in the workplace itself. So if you have a student who graduates and goes right out into the world of work, what kinds of employee benefits do they have for counseling and access to services? That it doesn't just have to end outside of school, but just knowing that there's still that added layer of support. But nights like this and getting resources that you may or may not have known ever existed, and there are a great deal of resources in not just Ontario County, but just Canandaigua in general. And I think although we are probably sick of Zoom, I think the Zoom rooms and telehealth has really helped elevate the access that many of us wouldn't have had otherwise. So keep continuing that conversation and keep that open communication between you and your child. Talk about their fears, talk about what they're worried about in post-secondary, but don't make it a mystery.
Great, thank you. And one of the things you've all kind of referenced a bit this evening is the distinguishing factors between when something might be that typical behavior and then when does it manifest itself into maybe some things that we might need to be more concerned about, which I guess, Dr. Mitchell, this next question is for you then. What supports are available or perhaps proven effective when a child maybe begins to exhibit some school avoidant behaviors, let's say, due to their mental health, whether that's depression, anxiety, or other things that are impacting them to want to come to school?
Sure. Sorry. So, so school avoidance, I think the first thing I wanted to say about that is that it itself is not a disorder, but rather is a sign that a child might be struggling in some way. It's very common to see school avoidance associated with underlying mental health concerns or mental health disorders. And often they present in a very physical way. So like Katie said earlier, stomach aches, chest pain, those sorts of things. And oftentimes they'll present to doctor's offices, things like that first, which is a good thing to rule out medical causes, but then often there's not a medical cause per se, like a physical medical cause. So many kids too, just to keep in mind, like many children and teens really aren't able to articulate what's really going on. And I think that sometimes can be frustrating, since I have 2 children of my own, as a parent to understand that they may not understand exactly what they're going through and what they're experiencing. So there are many ways that parents can really help a child who is missing a lot of school or starting to kind of develop that kind of pattern of school avoidance. And I think one of the biggest, most important things that I could say is that early intervention leads to the best outcomes. So when parents start to notice these patterns, whether it be getting up late, kind of dragging their feet, complaining about aches and pains, stomach aches, things like that, which is difficult nowadays because we have to be so hypersensitive to it because of COVID, which creates an extra layer of trying to figure out like what's really going on. But getting that child to go to school and get back into school as quickly as possible will lead to the best outcomes. The research shows that the longer that a child is out of school, the worse that those problems become, which very much is in line with how mental health disorders operate. Avoidance and escape sort of behaviors, so missing school because, whether it be, you're trying to avoid school because school in and of itself, like going to work, is stressful. It's a lot more stressful than being home, watching TV or playing with toys. So just even by its very nature, it's more stressful. And so therefore, if a child is struggling with an underlying undiagnosed mental health problem like anxiety or depression, it's naturally going to manifest more at school. So, so whether they're avoiding it for that reason or other reasons, they often, they experience that increased anxiety, and the faster we get them back into the school, the better, because avoidance kind of perpetuates this whole cycle, and it keeps this vicious cycle happening, even for the anxiety disorder, the depression. So I think, again, early intervention leads to the best outcomes. And I would say with that, like I said earlier, talking to kids is really important. Talking and listening to kids when they're sharing things about their day. Often, as many of us parents know, that might look very different. It might look like defiance, or someone's expressing a lot of anger. But keep in mind that that could be a manifestation of some underlying struggle that they're dealing with. So asking them like how their day was, and emphasizing, just that it's super important, in spite of how they feel, for them to be in school, and then that's your position. I think that's the other thing, is to you want to listen, be empathetic, but at the same time kind of set that expectation that it's really important that they return to school, and that you're going to sort of ally with them, if you will, to fight against these kind of feelings that they might be having, whether it be anxiety or depression. I think the other really important things for parents is to notify the school immediately when they're starting to see these patterns and signs of school avoidance, because like Katie said, and actually everybody has said, it's one of the most important things, I think, to successful kind of treatment outcomes or just good outcomes for your child, is collaboration across so many different areas. Children, they don't exist in a bubble. They have a whole community that's surrounding them, and the more folks that you can include and who are collaborating on your child in your own behalf will only benefit your child. So I think the sooner that you notify the school, the sooner they can, reach out to counselors or others to help develop plans to really help support your child and what they need. The other thing is that can help with, evaluating what's really going on, doing, they can do a school assessment if you request that, to see what's really causing this anxiety when they're at school, to really kind of help identify what's going on. I think the other thing is too, like Peter said, it's really important when you start to see the school avoidant behavior that, especially if it's starting to become a pattern, that you seek out professional help. Oftentimes, as I said, the majority of times, there is some underlying cause, whether it be anxiety, depression, a mix of those things, a learning disability. There's a whole bunch of things that could be underlying that could lead to worse problems. And so I think that, really seeking out professional help can be super helpful to a child in trying to identify what's really going on, but then also get them the proper treatment. And in many cases, the help of a professional is required, especially if a child is out of school for a longer period of time, like I said, because that's more difficult, because that cycle has been continuing for so long. It's reinforced, and it's more difficult just to correct or undo, if you will. So there are a number of effective talk therapy treatments that are research-based, that show that there's efficacy, and there's a number of things. So things that you would want to know, and when you're seeking out a professional as a parent, would be, you'd be looking for things like, are they doing interventions like cognitive behavioral therapy, which really looks at how your thoughts, your feelings, and your behaviors work together to create certain patterns, and then really kind of honing in on how can we change a person's or child's negative self-talk to really help them to feel more supportive, and to minimize some of those negative emotions that are kind of perpetuating these cycles. The other effective treatment is dialectical behavior therapy. That would be another one, or DBT, that you would be looking out for, and it's very similar to CBT. It's really a sibling, if you will, or a cousin to CBT. So they're very much looking also at how thoughts, feelings, and behaviors impact the mental health behaviors and disorders, and really helping them learn skills to tolerate like distressing or anxiety-provoking situations. So you're really, the other things are relaxation strategies, breathing, social skills development, because oftentimes for some kids who avoid school, it's those peer interactions that are, you know, so much a part of the school environment that are difficult to navigate. And that's really kind of part of adolescence, is trying to learn how to navigate those things, and they're not easy. And so some of the strategies might be to, like if a child is anxious about those situations and maybe has a social anxiety disorder, having that child, you know, role play with a therapist about how they might talk to friends or adults or whatever interactions are making them more anxious or more upset, can be really helpful and expose them to some of their fears gradually and over time. So these are some of the interventions that you'd be kind of looking out for as a parent to get help for your child when they start to develop some of these avoidant behaviors.
Thank you. So for our panelists, we have about 10 more minutes before we want to provide the audience an opportunity for question and answer. So we'll probably have time for maybe 2 more questions. We'll kind of see how things go. But the next question is for Cindy. So Cindy, you referenced a lot of the supports that are available at schools, but the schools do so much more within the realm of mental health on the teaching side of things. So what is being done in our schools to try to help teach acceptance and understanding for people who might live with mental illness?
So what we're talking about is how do we destigmatize mental health? And the first step in destigmatizing mental health is talking about it, not being afraid to talk about it, not shying away from the topic. So as an example, if you walk the building, this building right here, you'll see PSAs. Those PSAs are public service announcements that are made in our health classes by students. And we cover such topics as mental illness, awareness, suicide prevention, other teenage kinds of topics. So the topic of mental health is covered in our health classes. We have a very robust health curriculum, grades 6 through 12, and we cover things like mental illness, mental health, signs and symptoms, causes and effects, stigma. We talk about statistics, and we talk about resources. And speaking of resources, in health class, we have different agencies come in from the area. I can think of one specifically called NAMI, which is the National Alliance for Mental Illness. And they come into our health classes, and they talk about their journey through mental illness. So we do lots in our health programs. We also have are embarking on our 4th year with a program called Sources of Strength at the high school program, and this is a collaboration with the University of Rochester. And this is a suicide prevention program, but it also impacts other issues like mental health and substance abuse. But the idea behind Sources of Strength is it actually harnesses the power of peer social networking in order to change unhealthy norms. So what we do is we train peer leaders. So we don't train typical peer leaders. We train peer leaders that are leaders within their social group. So they are leaders within their circle of influence. And we train them. We have a training coming up on October 22nd. And we really teach them how to help a friend. So Sources of Strength acknowledges that we all go through tough times. We'll never be able to get through life without going through tough times and challenges. And so we all use our strengths in order to get through these difficult times. And we also can grow in some areas as well. So what we do in Sources of Strength is we implement campaigns throughout the school year that are aimed at reaching the whole student body, and we try to grow these strengths, things like family support, healthy activities, mentors, positive friends. We grow these areas. And another significant thing with Sources of Strength is it helps connect students with positive adults in the building that can help that can help students get to the places that they need to get to when they're in trouble. So we're really fostering that connectedness between the positive adults in their lives and the students. So another program that we'll be implementing this year is in our health classes is something called Teen Mental Health First Aid, and we'll be implementing that at the high school level. And typically our kids take health in 10th grade, so every 10th grader this year will get 5 days in the health curriculum of Teen Mental Health First Aid. I'll be teaching it with the health teacher. So at the end of 4 years, all of our students would have received 5 days of mental health first aid. And it teaches high school students how to identify, understand, and respond to symptoms of mental health challenges and what they can do to not only support themselves, but what they can do to help a friend in need who is struggling. We do know that teens typically confide in other teens, and so we are giving those students the skills that they need to not only foster their own wellness, but to help a friend. At the K through 5 level, we don't necessarily talk about we don't call it mental health, we call it social emotional learning. And at the K through 5 level, counselors and teachers are working in the classroom on things like self-awareness, self-regulation, decision-making. And it's our hope that as the kids grow and learn in these skills, which they are already doing, they are going to come up healthier and more just healthier individuals up at the high school level.
Thank you. And so, Katie, perhaps one final question before we afford ourselves some time for some question and answer from the audience. We've talked a lot about the toll that mental health can have on our children, but also as families are going through trying to support and try to figure out how to best support, that can really impact parents. So question really is, what if any, support groups are available for parents who might have teens struggling with mental illness?
So Cindy mentioned NAMI, the National Alliance on Mental Illness. They have a lot of outreach, and there's a Rochester chapter. So there's a lot of outreach and a lot of family to family, student to family, or adult to children resources that they have available and programming that they offer. I haven't been able to take advantage of anything more recently, but I know that they often, if you check out their website and look at some of their materials, you can find some access there. I also have had some opportunities to work with Golisano Behavior Health and Wellness. They just opened up a new facility about a year and a half ago, I think. And there's a lot of resources that come out of that building, both outreach, if you can get there physically, they have some opportunities, but there's outreach there. And I think, too, just talking with the counselors at school and finding, what other resources are locally. But those two are some ones that I know about more regionally that happen specifically for around those areas, and a variety of areas of mental health, not just mental anxiety and depression, but suicide prevention, suicide experienced families, and the such. So there are a couple of major resources, and I'm sure there probably will be more out in the atrium.
You stole perhaps my segue after the question and answer period. Yes, thank you. So thank you to our panelists for responding to those questions. In the event that we don't have any questions from the audience, we may try to build in some of our remaining questions, take us right up until 7:30. But at this time, if there are any members of the audience that would like to ask a question of our panelists, please feel free to approach one of the 2 microphones at the end of the aisle, and we'll give you a moment to do so if you so choose. Yes, please, just so that the folks perhaps listening at home have the ability to hear your question. Thank you. That was far less wait time, by the way, than I anticipated. That was way better than any classroom. So
I was thinking, this is awkward. So I had a question regarding social media, and I was just curious how a parent can strike a balance between letting their teenagers use social media, but we know the problems that social media can cause with mental health, and how to go about striking a healthy balance.
So you're absolutely right. It can be definitely a trigger for some of those kind of peer interactions, and unfortunately, as we all know, cyberbullying and things like that. I mean, misinformation, you name it. Social media can be a very positive thing, but it can also spread some really negative things. So what we talk about with families in the clinic is really trying to set limits around, you know, those things and how much time kids or teens are spending doing those things. And also, we recommend things like there are parental controls where you can put certain applications, restrict certain applications on different devices. There's also different applications that you can download onto your child or teen's phone or tablet so that you can, you know, track certain things. We typically don't recommend those necessarily right out the gate, but if it's something where your child is kind of presenting with these, you know, kind of consistent problems with, you know, getting onto websites or things that they shouldn't be, or getting involved in, you know, things with other students that are kind of bringing down their mental health and making, kind of exacerbating things that are already going on, then that might be a time to consider like some of those tracking kind of devices to help to minimize and know exactly what your child is accessing. But I also think one of the things that we talk with families about is, I mean, that's the reality of our world right now, is that, you know, social media and those different things, I mean, restricting them entirely unless there's a certain situation where that requires it, like kids on probation who may not have access to internet and things like that for certain reasons. But generally speaking, that is our world. And so we talk a lot about helping teenagers to really kind of learn how to limit their own access and really help them identify, you know, that this might be a trigger. And so some of the strategies that we might use in our therapy sessions would be like tracking and seeing like when certain things, you know, like when certain emotions, big emotions are present, like what was happening. Oftentimes they will share that, you know, it was this or that interaction or this social media post, or, you know, people were doing this or that. And so part of it is also trying to, not only as parents, like have that kind of like limit setting to help them establish boundaries, but also helping them to establish their own boundaries. Like, when is enough is enough, or when should you block a person? When do you think it would be a good time to, you know, do this? And when would it not be a good time to get on social media? And so we try to really kind of work with the adolescents as well around their own boundaries with that, because this is here to stay pretty much. Mm-hmm. So it's kind of a combination approach.
I think just to add to that, I think as parents, caregivers, and professionals, I think our approach is so important. You know, for instance, you know, if we need to talk to a young person about social media, you know, sit down at the table, we need to have a talk, right? Versus, you know, you're driving in a car and, you know, hey, let's go to Dunkin' Donuts and get a coffee, and, you know, you happen to bring up social media in your conversations. And, you know, so I think the approach is so important for us in terms of creating those lines of communication, whether you are a parent or a caregiver or a professional, you know, to be able to keep those open lines of communication. I know for one, I'm not a social media person, so, you know, one of my approaches is always, you know, teach me about this. You know, how does this work, right? And so many times you can kind of get your foot in the door for those conversations and for those meaningful conversations just by your approach, and also the importance of doing more listening than talking. I think that is so undervalued in some instances, but just to be able to listen and just to let that young person know that you're willing to listen. And so many times they'll tell you a lot more than you probably want to know. And that can be a really nice bridge to having those hard conversations that lead into limit setting, and, you know, when to block somebody, and, you know, when a friend isn't a friend on social media, those types of conversations.
Okay. Are there any other questions from members of the audience? Please feel free to approach the microphone.
Good evening. My name is Andrea, and I have a question regarding, could you share 3 main things that you would help a parent with for signs of suicide? I know that, we all think of, writing that note. Maybe there's something new that's come up in research or that you could share so that parents know what they've really got to look for.
It was one of my questions, so I might as well answer. So that's a really great question, and I'm glad you asked it. Because, especially now, there's just so many different stresses and so many different things that are going on in this world that, people are struggling, and teenagers and children are struggling. So I think it is important to talk openly about suicide and, violence. So if you're worried that your child may be thinking about harming themselves, or maybe you've heard them say things like, oh, I wish I were dead, or talking a lot about death, those kind of things, you see those kind of themes. Many people feel worried to ask their child outright whether they're having those kind of thoughts, because they're afraid that they might implant those kind of ideas in their mind, or if they weren't already thinking about it, now they might be. The reality is that research shows that talking about suicide and being open and direct in our conversations and questions about it with our children as well as each other actually minimizes the impact of that kind of isolation that having those thoughts and having those experiences creates. And so what we found is that being very direct, if you have concerns about your child and you're seeing these patterns, these changes like we had talked about earlier, where you're seeing them isolate, you're seeing that they're a little bit more sensitive, maybe easily frustrated, and you're starting to kind of see these patterns, then, it's okay, and it's actually recommended that you check in with your child and say, hey, I've noticed, these different things. And sometimes that, means that folks are struggling. And I want to ask you, are you having thoughts of killing yourself? And come right out and say those words. I actually, in crisis intervention training, we teach law enforcement. And it's funny because they have to ask those questions as well. And you see the reluctance in asking those questions, and oftentimes we'll ask questions like, do you feel like harming yourself? Well, that's a good question to ask. Children and adults see there's a big difference between wanting to die and kill yourself and wanting to harm yourself. Most people don't want to experience pain. They want to avoid pain. So they see those as very different questions. And oftentimes, in a lot of anecdotal kind of studies, when they've talked to people who were suicidal and maybe even attempted suicide but survived, they responded with that, people talking with them about it, asking them how they're doing, actually helped them to feel less alone, less isolated, and that somebody really cared and to kind of listen. So I think that it's recommended that you just kind of come out and ask. I've noticed you've been, talking a lot about death and wanting to die, and I care about you. I'm worried about you, and I'm wondering, are you having thoughts of killing yourself? Are you having thoughts of suicide? Then, oftentimes I think being curious, asking more questions. Let's say that they acknowledge, yes, I've had, thoughts about wanting to die, wanting to end my life. And, I know for me, if my child had those words come out of their mouth, that would be really heartbreaking to hear. And at the same time, what they need in that moment is for us to stay calm, to really listen and try to understand what's really truly going on, and to be curious and ask questions. Can you tell me more? when did this start happening? Like, how often is it happening? What kinds of things are you thinking about doing? And kind of really trying to drive down into like, do they have a specific plan? Have they started preparing for things? Have they kind of solidified this sort of idea? And if that, kind of is the path, I would say that that's when you need to get some immediate help and get your child immediately evaluated by a mental health professional. Cindy earlier had mentioned the Clifton Springs CPEP program, and they do have a mobile crisis team through there. And it depends, on their availability. They have to have 2 people to mobile out into the community, but they can also mobile with, they can come to school and actually meet here. So they only need 1 person to mobile to school. They can also mobile with a law enforcement officer with only 1 individual. So it really kind of depends, but that would be something that you could reach out to in advance, let's say, and say, dial up CPEP and say, are you available to, do an evaluation of my child, and they could potentially mobile out to your home so that you wouldn't have to go to the emergency room. However, taking them to any local emergency room, every emergency department has to have a person who can do a psychiatric assessment. And whether that means then the child gets sent to CPEP from there, it depends. So, but Clifton Springs Hospital is our CPEP. It's our local CPEP. So we often will recommend that people just go straight there. But you can call in advance to see if they can come out to your home. So I think it's really important just to kind of make sure that you're kind of keeping an eye out for those signs, those changes in your child, and being direct and being intentional with your questions, and really trying to show that you care and really are trying to understand, and that they're not alone. You're gonna work with them together to kind of find solutions to help them, rather than, you don't want to say things that might make them feel like, things will get better, this will pass, don't worry about it. You want to take those things very seriously, because even in the clinic, it's really not a typical thing for us to hear from someone who's coming in for mental health treatment. We treat those kind of answers very seriously, because while it's common to have those kind of thoughts, and sometimes they can be chronic for especially some of our teenagers, and not necessarily imply like intent, there could be intent there. And so we want to take those very seriously, and I would seek definitely professional help immediately. The other resources, just to kind of mention, Lifeline or 211 is another resource that families can reach out to. They have resources where they can connect you to different, tell you about openings and different programs. There's also, obviously, if there's an imminent worry, like the child, is upset and then, leaves the house or something, then you would want to call 911 and have law enforcement get involved. And I like to share with everybody that you can request a CIT officer. You can request an officer who is trained with mental health awareness and de-escalation skills, so that when they're arriving to that scene, they have extra training in those areas, and they can be more patient and really more present. And oftentimes they also have iPads or things that they can connect to CPEP through there. We have a MAP program in the county. So many of our law enforcement have access to CPEP directly through an iPad or a phone.
Thank you. That's all very great information. And we are at the close of our panel portion of the evening. So if you have additional questions, many of us will be hanging around after if you'd like to connect with one of us, or perhaps these might be some of the same questions you can ask some of the providers that are in attendance this evening. So as we close this evening, thank you so much for attending. We hope that all of you are able to walk away with a few pieces of information that will help you in some way. Our schools are often viewed as the hub of our communities, and they are committed to cultivating partnerships, many of which have been described this evening with the county and our families, especially as it relates to supporting and promoting mental health and wellness. So as we close, I'd like to thank our panelists. We certainly appreciate your time and willingness to share your background, expertise, and experiences with us this evening. Can we please give them a round of applause and thank you. I'd also like to pass along a few more thank yous before we officially close. I'd like to thank Leanne Ducharme, Jamie Glover, Beth Aparo, Caroline Chapman, and Jennifer Miller for serving as members of our planning committee for this evening's event. In addition, I'd like to thank Matt Rogers and his team for supporting the use of the auditorium and all the audio-visual needs for tonight's event. One final reminder, the recording of tonight's event has been live streamed and the recording can be found on the Canandaigua City School District's YouTube page if you'd like to reference the recording for either now or in the future. But at this time, we would encourage all attendees to take advantage of the resources located in the atrium just outside the auditorium doors. Please get home safely and have a great evening. Take care. Thank you.